Hi, I am Abdulla Bin Rashee from Indian State Medical Institute. So today is my topic is about auscultation of intestine. So we'll talk about the introduction. Actually, auscultation of the intestine is a fundamental clinical skill in abdominal examination, and it provides vital information about gastrointestinal motility, and it helps identify the pathological conditions such as like bowel obstruction, like pyloric ileus, or vascular abnormalities like Brug's. So this technique is non-invasive and quick and essential in both emergency and routine physical examinations. And principle of intestinal auscultation. Auscultation is a performance that is using a stethoscope, typically after inspection, and therefore before palpation to avoid alternate bowel sounds. So the diagram of that stethoscope is placed on various quadrants of the abdomen, like right upper, right lower, left upper, and left lower quadrants, and it is to detect the frequency, pitch, and the quantity of bowel sounds. So now we'll talk about the normal bowel sounds. Normal bowel sounds are high-pitched gurgling noises occurring every 5 to 15 seconds that represent the peristaltic movement of air and fluid through the intestine, and these are often described as borborygmy. It is a healthy individual. These sounds are typically heard in all quadrants. So now we'll talk about the abdominal findings. So as we know, we have like 4 to 3 types of abdominal findings in the intestinal examination. So the first one is hyperactive bowel sounds that may indicate gastroenteritis, that in early intestinal obstructions or diarrhea, and the next one is hypoactive or absent bowel sounds that are concurring for ileus, peritoneus, or late stage obstructions, and the third one is high pitched thickening sounds which rushes may suggest mechanical bowel obstructions, and the fourth one, which is last one, that is Brug's, which are vascular murmurs that may indicate vascular conditions such as like renal arteries stenosis or the abdominal aortic aneurysm. So the clinical significance, we'll talk about the clinical significance. That is, intestinal auscultation can give diagnosis treatment. For example, in suspect bowel obstructions, the presence of hyperactive bowel sounds followed by the silence that may suggest progression to a dangerous pyloric state, which is similarly the absence bowel sounds postoperatively may indicate an ileus requiring medical interventions. So technical tips, we can say that ensure acute environment, also warm the stethoscopes to avoid abdominal muscle contractions, and listen for at least 1 minute for a quadrant it bowels sounds or may not immediately hurt. Evaluate over at least 1 minute to confirm absence of sounds, like complete silence over 3 to 5 minutes is considered significant. So here we go for the conclusion. Actually, auscultation of the intestine, that is a crucial element in abdominal assessments, and mastery of this skill and enables early detection of serious abdominal conditions, and it improves the diagnosis accuracy. As future medical professionals, we must refine our auscultation techniques to better serve our patient. So here we conclude, and thank you for listening to my voice.